we've had this discussion one too many times. I don't know why your husband left you, but it's not for me to do with. I'm at work right now. I know that we sit next to each other and we're both receptionists, but that doesn't mean we can gossip. There's somebody here watching us talk right now. Yeah, be quiet. Hi there, welcome to the ASMR clinic. My name is Stephanie, I'm the receptionist. Nice to meet you. Alrighty, so do you have an appointment with us today? Okay, so you're the 12 p.m. Can you confirm your name for me, please? Okay. That is what is matching up with my records. So, I just see that you're here for a normal doctor checkup. Is that correct? Alrighty. I'm just writing down that you are indeed on time, which we really do appreciate our clients that come 15 minutes early to their appointment. It makes it so much easier on us as well as Dr. Lily. It's really easy for her to get overwhelmed, and clients come late and then it messes with everybody else's appointment. So we really do appreciate you coming here so early. Do you have any questions for me before we get started? Payment, insurance questions? Now I see here that you are still with Anthem, is that correct? Great. Can I see your insurance ID, please, your policy number and all that jazz? Thank you. I'm just going to confirm it with what I have wrote down here. Okay, everything's matching up. There's that back for you. I'm going to get a sip of my Alani. It's early. But you've been doing well? Good. I know you are a regular of ours, so we always like to check up on our people. Alrighty, so just do a basic checkup. Now, did you get our message that your visit today is just $20 even? Would you like to pay for that before our visit or after our visit? After. Okay, I'm gonna put a little note here. Alrighty, so I believe Dr. Lily is available at the moment. I'm just going to holler down to her and check, okay? Thank you. Dr. Lily, you have a patient, are you ready?
Yes, send them in.
She is ready for you. So what you're going to do is you're going to go down this hallway right here. She's that first door on your left, okay? Awesome. Alrighty, well, I'll see you after, okay? I wish the best of luck. Have fun. I'm going to be checking his glucose and blood sugar levels. James, come on and take a seat. Hi, Dr. Lily. Yes, you remember me. Okay, good. It's very nice to see you again. I'm so glad you're doing well. Alrighty, so can we kind of go over what we're doing today? Yes, we are doing a basic checkup today. But I know at our last visit you did mention that you were feeling some more lightheadedness, experiencing some dizziness and some fatigue. So we're going to kind of look into that as well today, okay? So first thing I want to do is kind of go over your history with your family. And also your medical history, so it's kind of a 2-in-1 here. So I want to ask you, I didn't see anything in your files referring to diabetes in your family or anemia. I kind of want to ask you some questions about that, because maybe we can tie in what you've been feeling recently with some blood, with some family history, not blood, I guess bloodline in a sense. So is anyone in your family been diagnosed with diabetes, whether it's type 1 or type 2? Your father is a type 2 diabetic? And so is your uncle. Okay, so it's sounding like your father's side of the family does have some diabetics in it. Okay, good to know. So this could be a genetic thing. It's probably like nothing to worry about. I also want to ask you, is anybody in your family anemic that you know of? There's no anemic in your family? Okay. Alright, so I know we mentioned that kind of at our last checkup, and what I want to do is have you come back in 2 weeks for blood work. I'm still going to proceed with my usual checkup that I was going to do anyway, but I wanted to get that out of the way first. I want you to come back in 2 weeks for blood work, okay? You're going to tell the receptionist that when you leave, and I'll remind you that, okay? Yes, we're going to check your blood levels, and from there, I'm also going to have them check your glucose as well, and then from there on, we're going to kind of assess what's going on with you, whether it's diabetes, whether it's an underlying issue that we need to take care of. We'll kind of go from there. So there's nothing to worry about until we figure out what's going on. I'm really sure this is just diabetes and you're just getting it really early on because it is genetic in your family. You probably are going to get it sometime in your life. Okay, that's kind of how that genetic stuff works. But we're going to proceed with our checkup today, so no more questions, I promise you. Alright, so first I'm going to do sanitize. Can you tell me how you've been feeling lately? You've been feeling good. besides the dizziness and the fatigue. Alright. So the first thing I want to do is I kind of want to take your blood pressure. So let me reach into my kit here. Alright. Is there a certain arm that you would prefer? No? Okay, I'm going to do this one. Just lay your arm flat for me. Thank you. I'm going to get it wrapped. Alrighty. It makes a weird noise. I'm sorry. I don't know why it does that. Okay. Your blood pressure is a little bit high. Are you feeling nervous? It's okay. It's alright. I understand. Alright, so I'm going to write down your blood pressure. Your blood pressure was 130/80, so that's pretty high. One time I had mine, it was like 140/80 when I was really nervous. I'm a doctor and I still get nervous, so it's okay. Alrighty. So can you kind of just walk me through what's been going on with you lately? I know you're feeling dizzy, fatigue, stuff like that. Have you been drinking anything like energy drinks? I have an Alani here myself. You had an energy drink yesterday? You had a Celsius yesterday? Okay. So sometimes those can spike your blood levels and also your blood pressure as well. Because I've went to doctor visits before, and also just being a doctor, they really get you pumping, right? That's kind of the point of having an energy drink, and they can get you really wound up, which can affect your blood because of some of the ingredients in here, right? So I typically tell my patients to not drink any energy drinks or coffees before they come in. It does interfere with your blood work and give us inaccurate results. No, it's not your fault. I'm not like trying to patronize you or get mad at you in any sense. You didn't know. So now next time you know to probably like just wean off of it for like a day. If you are like caffeine addicted, just have like a soda or something. Just no energy, no coffee, no energy drinks, no form of anything, no drugs would be preferred. But it's okay because like I said, I have Alani with me. You just saw me sip it. I understand. I have them too. You're human. We're all human. It's fine. Okay. I also want to take a second here. I want to look into your eyes. Okay. Thanks. I'm gonna take my glasses off. Okay. So just look straight ahead for me. Okay. Okay. Other eye. Oh, I don't know why I did the other eye too. Ahead, please. Thank you so much. Do you mind if I get up close and kind of open your eyelids, look into them? Not with this though. Thank you. I'm gonna get them over here. Let's see. Okay. Okay, other side. Okay. Everything looks right with your eyes. I'm gonna jot that down. Your eyes are responding properly to me opening them. They're dilating. Great. Okay. I'm also going to take my tool here and I'm going to take a peek see in your ears, okay? I'm going to get up. Okay, I'm going to just kind of come around here. Now, do you clean your ears regularly? Like, do you use cotton swabs or? You do? Okay, good. Your ears look really, really clean, and that's why I was asking. I'm going to go to the other side here. Yes, I can see that you take really good care of your ears because there is minimal earwax in them, and that's great. High five. Pew. Good job. Alright, ears look great, and you can hear me properly, right? Good. We're all obviously going to have earwax buildup. That's just kind of part of being human. But I'm really, really proud to say that there's not much in there, so that's really great. That's good for you. I'm also going to have you open your mouth for me. I'm going to take a peek see. Open. Take your tongue. Perfect. Alrighty, I don't see anything that I should be concerned about. I'm not a dentist. You can close your mouth. Thank you. Your mouth looks fine. You can take your tongue out, so I'm not concerned about that. This is not a cranial nerve exam, so we're doing great. Do you mind if I feel around your stomach? I'm not going to go chest. I'm just going to do your stomach, push around, make sure nothing's tender or hurts. Thank you so much. Alrighty, so if you just lift up your shirt, just revealing your stomach, nothing more. This is not a nudist thing. Great. I'm going to push on your liver. And does that hurt? push on your stomach. Does that hurt? It's not tender at all. Okay. I'm gonna push. Does that hurt? Nothing's tender. Good. No tenderness. Stomach. Alrighty. I'm gonna also focus on your head for a second. So I'm gonna have you reflect the movements that I do. So if I'm gonna look this way, you do the same. Turn your head as far as it'll let you look this way. Good, 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 good. Now look the other way. Turn your head as far as it'll let you. Beautiful. Look up for me. Hold. Good. Now look down and hold it for me. Good. I'm just taking notes as I go, so don't mind me. Alrighty, so I'm going to give you this base allergy thing. So basically what this is inside is something that everybody's allergic to. I'm just trying to see if you are allergic to it, okay? If you hold out your arm, I have something that's going to take it off automatically. We're just doing a quick little allergy test. So, yep, roll up your sleeve. Let's see. Okay, so in this is an allergy base that humans are just allergic to in general. It's kind of a combination chemical base. So what I'm looking for is to say your skin tone red, you're not going to break out in eyes or anything. It's a very minimal concentration. Where it's kind of taken to being, it has wheatgrass in it, which most humans are allergic to. Okay, it doesn't take long to react with. And I have this solution here. This is an anti-allergy. So this is just for small little allergies with like red patches and stuff like that where you get itchy. Okay, yep, you're not going to break out in hives. I am seeing it get red. So what we're going to do is I'm going to put this on my hands, and distribute onto your arm. It's going to go away. You're not going to break out. I'm not here to kill you. Okay, now let that sit for a second. It's gonna go away. You're fine. All right. Now you've been staying hydrated, correct? But drinking plenty of water, especially with your fatigue and your dizziness, with your issues going on. Are you eating tons of protein? Are you making sure you're eating good, healthy foods? Because that could be contributing to why you're having issues. You've been trying to stay on a good diet. You're actually on a diet, okay? So what food have you been cutting out that's been perhaps contributing to this issue? You cut out sugar the best that you can. I get that. Heavy on protein, okay? So what kind of protein specifically are you eating? Chicken? Chicken's your main protein. That's my main protein too, I understand. You're trying to eat best you can. Eat 3 meals a day, okay? Alright, so like I said, you can put your arm back. You can roll your sleeve back. Yeah, it looks fine, I promise you. Nothing's gonna happen to you. So I want you to come back in 2 weeks for a blood test. We're gonna be focused on mainly your glucose and your blood sugar levels, and also looking at your iron. Your iron will tell us if you're anemic, and your blood and sugar will tell us if you're diabetic. Plus, we'll do more testing based on what we find, of course. But I really want to look into this because I'm anemic, so I get dizzy and lightheaded when my iron is low. That's why you might be diabetic because of your family history, but I want to look towards your iron levels first, just to kind of eliminate anemia as an issue first of all. And then we're gonna kind of go from there. Okay. So when you go back to our receptionist, let her know that I ordered some blood tests. Obviously, she's going to figure out once I leave this room as well. But there's nothing else I want to see from you today. I think you're doing great. You sound healthy. I just want to get to the problems with this fatigue, dizziness, lightheadedness, stuff like that. Okay? Yeah, there's nothing else I need from you. You are totally free to go. Just make sure you go back to the receptionist and let her know what we did today, okay? It was really good seeing you. We'll see you in 2 weeks for your blood draw. Bye now. So he slept with his receptionist, and you don't know if you should divorce him or not. First of all, he cheated on you. You're a grown woman. You can provide for yourself. I think you should leave him. Hi, I have someone here. We can talk about this in a second, okay? Thank you. Hi. So how was your appointment with Dr. Lily? You're gonna come back in 2 weeks, okay? Did she give like a reason? You're gonna do a blood draw, blood test, okay? You might be diabetic or anemic. She's not sure. Okay. Alrighty. So if you remember, you are paying your $20 today. You're gonna have a card? Alright, so right there's a card reader for you. I'll let you put in all your information. Yeah, I don't like blood draws either. I actually have a fear of needles, which is why I'm not the doctor. So, oh yeah, and we'll send out a message reminder for you when you need to come in for your appointment. I promise you, everyone is scared to get their blood drawn. It's uncomfortable, it hurts, they poke you. It's not a fun thing, and we understand that here. We try to be empathetic and kind as possible. Oh, do you want your receipt? Okay. Well, thank you so much for coming in today. Don't be nervous about your blood draw, I promise you. If you are nervous when you come in, please let one of us know, and we will have some things to help calm you down when you come in. We understand it completely, and some of our doctors here don't even like taking people's blood, so we completely understand. Alrighty, well, thanks for coming in. I hope you have a great rest of your day. Bye. We'll see you in 2 weeks.